So good morning or good afternoon to everybody who's joining us. We will just be waiting a couple of minutes to let people log on and get settled into the webinar. We're also recording this webinar and we'll share the link to the recording afterwards. So we'll just wait a couple more minutes and then we'll get going. Thank you for your patience. Okay, so let's get started. So hello everyone and thank you for joining us today. My name is Georgette and I'll be moderating today's event. I, along with all the other speakers joining us today, work at the Stockholm International Water Institute. And this is the third in a three-part webinar series in the build-up to Stockholm Plus 50. Stockholm Plus 50 marks 50 years since the first ever environmental meeting, which led to the foundation of the UN Environment Programme. And Stockholm Plus 50 is an opportunity for decision makers around the world to reconvene and unite to protect people and planet. Water has a key role in achieving each and every one of the Sustainable Development Goals. Water encompasses social, cultural, political, and economic values. And Stockholm Plus 50 is a pivotal stepping stone to the landmark UN Water 2023 conference, where water's role in the sustainable agenda will be explored. Today's webinar will be focusing on how water, sanitation, and hygiene are key to safeguarding the health of both people and planet. We have three presentations. Each speaker will speak for around 10 minutes on their given topic. And at the end, there will be the opportunity to answer some questions. So if you do have any questions for our speakers, please do write them either into the chat or using the Q&A function, and we'll do our best to answer them. If we don't get the chance to answer them during today's webinar, we will of course do our best to answer them by mail afterwards. As I mentioned at the very beginning, this webinar is being recorded and we'll be sharing the link of this recording afterwards. So without further ado, I'd like to introduce our first speaker. Dr. Jenny Grönwall is a groundwater governance expert specialized in self-supply. But Jenny's interdisciplinary research also involves sustainable textiles manufacturing in India. She serves currently as SIWI's focal point for the human rights-based approach. Jenny, over to you.
Thank you so much, Georgette. Hello, dear audience. I am unfortunately down with COVID, so I will keep my camera off today. But in this presentation, I will take you back in time to when the right to a healthy environment was first conceived and say a few words about a human rights-based approach and the rights to safe drinking water and sanitation. And finally, I will highlight the role of groundwater resources in this. 50 years ago, a landmark outcome of the Stockholm Conference, or the UN Conference on the Human Environment, was a declaration in which Principle 1 says that man has the fundamental right to freedom, equality, and adequate conditions of life in an environment of equality that permits a life of dignity and well-being. And he bears a solemn responsibility to protect and improve the environment for present and future generations. While this declaration was not as such binding on the world's governments, it marks the conception of the human right to a healthy environment that has just recently been acknowledged. Soon after the Stockholm Conference in 1972, country after country acknowledged some type of environmental right or responsibility through a regional treaty and or in their constitutions or domestic law. So today, 80% of all UN member states do this. And in October last year, this development resulted in that the UN Human Rights Council adopted Resolution 4813, recognizing that having a safe, clean, healthy, and sustainable environment is indeed a human right. For more than 2 decades, the world community has subscribed to a human rights-based approach to development cooperation. The United Nations has decided on attributes for this approach, being that the goal is that all programs of development cooperation, policies, and technical assistance should further the realization of human rights through a process in which the human rights standards and principles guide all development cooperation, with the outcome being that development cooperation contributes to development of capacities of so-called rights holders, meaning all of us basically, to claim our rights, and of duty bearers, primarily governments, to meet their obligations under human rights law. Now, there cannot be any human or other rights without corresponding obligations. At the Stockholm Conference 1972, India's Prime Minister, Indira Gandhi, in her speech, observed that the individual will to freedom has led everyone to believe that they have rights with no corresponding obligations. In other words, she lamented that people tend to forget their duties and responsibilities to others and to future generations, but remember their rights and entitlements. And these words from half a decade ago ring true still today. Now, what about the rights to safe drinking water and sanitation? They are both intrinsically linked to the highest attainable standard of physical and mental health, that is, one's own and others' rights to health, including those that, for instance, handle wastewater and sewage, or live downstream a polluted river, or use groundwater that has become contaminated. My colleague Ricard will talk more about this after me, so I will only say that the rights, those 2 rights were formally recognized in 2010 and entitles everyone to sufficient, safe, accessible, culturally acceptable, and affordable drinking water. Physical and affordable access to sanitation in all spheres of life that is safe, hygienic, secure, and socially and culturally acceptable, and that provides privacy and ensures dignity. So the first one protects access to water services for drinking, food preparation, personal hygiene, and washing for personal and domestic uses, whereas the right to sanitation protects also access to and use of wastewater facilities and services that ensures a clean and healthy living environment for all. It should be noted that the right to a healthy environment is much wider in scope than the right to water, as this new right also protects water resources upstream of the water services point, and also irrespective of there being a public or private provider of drinking water. Finally, now in 2022, we shine the spotlight on groundwater. Sorry. The demand for this resource is increasing, not least at domestic level, to satisfy the rights to safe drinking water and sanitation, but also to safeguard groundwater-dependent ecosystems and freshwater biodiversity. Groundwater provides half of all drinking water globally, and some 2.5 billion people around the world are estimated to depend only on groundwater for their needs. A global trend is that of households and communities self-supplying, that is, providing themselves with the water they need, and they do this in response to not having access or being inadequately served with pipe water from a water utility or other type of water provider. So people then arrange their own water access, mostly from dug wells or boreholes, which can be their own or some that they share with neighbors or a community. We also hear about self-supply in terms of households going off-grid, for instance, when tariffs are raised as a water demand management effort. We saw this in Cape Town, for instance, in conjunction with the Day Zero a few years back. And we can also conceptualize self-supply as a climate change adaptation or coping mechanism when surface water sources dry up and households essentially find that they need to fend for themselves because society, governments are not doing that for them. So if we can witness an increase in people serving themselves with groundwater, what does this mean from a human rights perspective? What is the role of the state? According to a study I had published in 2020, our governments do not have a duty to fulfill the human right to water through direct water service provision. They only need to do this as a last resort solution, except where people cannot reasonably be expected to have their own means or mechanisms to self-provide, such as after a natural catastrophe like the recent floodings and deadly heat waves in South Africa and India. But state governments are to ensure good governance and sustainable water resources management to prevent climate change effects and to minimize impacts of competition over the same sources, groundwater and others. And they must also enable users to have adequate awareness regarding sustainable groundwater abstraction and to know when drinking water is safe so as to protect their health and that of others. So this boils down to the role of the state being involved in facilitating end users to self-supply themselves and to build their own capacity. And that was all that we have time for today. Over to my colleagues. Thank you.
Thank you so much, Jenny, and thank you for joining us despite being a little under the weather. We really appreciate that introduction you've given there, not only to the linkages between the human rights and things like groundwater, introducing self-supply there as well. But I thought it was also quite a poignant quote you chose to include on this idea that there are no rights without obligations. And I think we can head straight over then to our next speaker, Ricard. So Dr. Ricard Gine is an expert in sustainable wash services. He provides expertise, promotes research and advances knowledge with the aim of strengthening wash systems and promoting sustainable delivery of services. So over to you, Ricard.
Thanks a lot, Georgette. And yeah, just to highlight that my role today basically will be give you 2 cents on what Jenny has mentioned before in practice. I mean, I think that a lot has been said already in relation to the human rights to water and sanitation. Basically, the aim of this introduction is to highlight what this could mean in practice. So in the next slide, and I think that already Jenny referred to this, these human rights to water and sanitation basically mean that we need to make sure that all people have access to an adequate amount of water that is of adequate quality, acceptable, because this is very much linked to the quality, that it can be physically accessible, particularly if it is not serviced on premises, that it is affordable. And this is not the same as meaning that it's free. So people need to pay for water, but this does not necessarily meaning that it needs to be provided by free. And then of course, this focuses on domestic users. Then the human right to sanitation, much like to the water human right, it means that it needs to be physical and affordable access. So people need to have access to a toilet without putting them in danger, particularly women and children, that it's safe, so that the conditions of the toilet are adequate, that is socially and culturally acceptable, and is particularly relevant in specific cultures. And then, of course, that it provides privacy and dignity. So these are the characteristics of the water supply and the sanitation facilities should have in relation to these human rights. This, in the next slide, does not mean that we are aiming for a specific type of service. I think that Jenny has already mentioned that the provision of these services can be in different ways. They can be served at the household level through household connections. They can be shared, and they can be, of course, also available in public spaces, and they can be individual solutions. And then, of course, in relation to the management models, this can be provided by utilities, by NGOs, by other service providers, private and public, or even by self-supply, as Jenny was mentioning or was referring to before. But what I would like to highlight, and this is going to be done through 2 case studies today, is that this does not only refer to the household level, but in all spheres of life. That's why in the, after this short introduction, we will present 2 case studies. My colleague Henning will refer to specific case study of how wash services were provided in the pandemic, in the COVID pandemic in schools, and the impact that this provision had in terms of health. And then my colleague Laura will have a short case study, or will present a short case study on delivering sanitation services in public spaces. So I'll hand over to you, Georgette, for these 2 interesting case studies. Thank you very much.
Thank you, Ricard. And we'll go straight on to the first presentation from Henning. Henning Göransson is a program officer in the water and sanitation team at SIWI. He mainly works on accountability for sustainability project together with UNICEF, and has 8 years experience working in international development research, evaluation and policy, both as a researcher and a consultant. Henning, over to you.
Thank you very much, Georgette. So as Ricard said, I will give a quick overview of a study which we conducted together with UNICEF in mapping country responses to COVID-19, specifically focused on schools. And this study was particularly relevant in looking at how countries were preparing to reopen schools after the closures which happened because of the pandemic, and thus in realizing the human right to water and sanitation in educational institutions. I also want to mention that this piece of research that I'm presenting is top-down. So it's from the point of view of the service authority and the service provider, the duty bearer, as Jenny mentioned, and what they are doing to ensure the human right to wash in schools. And it's thus not focusing on the experience for the user. However, resulting from this research is follow-up support to specific countries where these aspects are, of course, in focus. So firstly, I'll give you a bit of background on the status of washing schools in general. I apologize for this slightly confusing slide, but this is showing data from the World Health Organization and UNICEF, the joint monitoring program for WASH, for the Sustainable Development Goals, showing the school coverage of access to basic water service in blue, basic sanitation service in green, and basic hygiene service in purple, in schools by continent or region. And basically what the colors mean, blue, green, and purple, that's good, and anything which is yellow is bad, and gray means that there is no data, and this usually translates to being bad as well. So if we're looking at water, we see that the basic service coverage in blue varies widely between different regions and countries. We have, for example, 100% coverage in Australia and parts of Europe and North America, to less than 20% in sub-Saharan Africa, Ethiopia and Guinea, for example. In total, about 69% of schools had a basic drinking water service, which meant that almost 600 million people lacked a basic service at school. And while progress is always being made, a 7-fold increase in current progress is needed to achieve universal access, universal coverage by 2030. Looking at sanitation, the basic service coverage in green, again, varies between and within regions. So for example, we have 100% coverage in Malaysia, but just 16% in Laos. 63% of schools had a basic sanitation service, which means that almost 700 million people are lacking a basic service in schools. And a 5-fold increase is needed in the current rate of progress to reach universal coverage by 2030. For hygiene, again, within Latin America, for example, we have 100% coverage in Cuba, but just 12% in Honduras. Only about 57% of schools had a basic hygiene service, which basically refers to hand washing, but also menstrual hygiene management and so on, which means that over 800 million children lack the basic service in schools, and a fourfold increase in the current rate of progress is needed to reach universal coverage. So in the study that I'm presenting, we focus on 2 regions where we work extensively with UNICEF. This is the Middle East and North Africa, MENA, and Latin America and the Caribbean, LAC. And in these regions, we see some disparities, for example, between the high income countries and the lower middle income countries. We see that primary schools are less likely to have basic hygiene than secondary schools. And we also see that there's limited information for some of the countries. In Latin America, for example, 4 out of 10 school-age children cannot wash their hands with water and soap in schools. And in MENA, there's an estimated 12 percentage point gap for basic hygiene services between primary and secondary schools. So the JMP data showed the WASH status before the pandemic. So an important starting point for the study was to see how the pandemic affected schooling. And education was one of the most impacted sectors in general. And in most of the countries in the world, schools and other educational institutions were closed for a prolonged period of time. And as you can see from the graph in this slide, LAC and MENA are regions with some of the highest average number of weeks of school closures. This is old data, but it still holds true today. And this can have disastrous effects on children, as longer school closures leads to increased risks of permanent school dropouts. And we haven't yet seen the potential serious and long-term consequences for economies and societies in terms of increase of inequalities, worsened health outcomes, less social cohesion. So the main objective of the study was to provide an overview by region of the actions taken by primarily governments, national and subnational governments, to ensure a safe return to schools, focused on WASH and WASH-related activities. And based on this mapping of the actions, we provided short and medium-term recommendations and offered some specific support to individual countries in some of these areas. And it resulted in the 2 publications you can see on this slide, and we can share the link to these after the presentations. The methodology for the study was based on the development of a monitoring matrix. We grouped these particular activities that countries could do under 3 intervention areas. Those relating to the enabling environment. So this is the institutional and social framework supporting WASH service delivery in schools. School hygiene and infection prevention and control, which is called IPC, and activities focused on ensuring WASH services. And under each of these intervention areas, activities taken by governments were mapped according to what they specifically referred to, finding 46 different response actions. And in total, we then grouped them into the 12 categories that you see on the screen here. So, for example, activities related to policy development. We also had activities related to multidisciplinary coordination or improving school WASH infrastructure. And we pre-populated the results based on publicly available information. And this was then reviewed and validated by UNICEF WASH and education teams and their government contacts who provided additional information to complete this mapping. And activities were classified either as implemented or as planned. So quickly to the results, starting with LAC. From the graph here on the left, we see that more focus was given to the enabling environment and school hygiene and IPC than to ensuring WASH services. And from the graph on the right, we noticed that while there were some efforts made to improve WASH infrastructure, very few countries implemented activities focused on technical assistance to service provider and service delivery arrangements. And both of these are critical for long-term provision of WASH services, the sustainability of these. But they are more challenging to address, they take more time, and perhaps therefore they're not addressed as they should be. On the other hand, we see many actions conducted by countries related to IPC, capacity building, and coordination. These are, of course, also very critical, but they are much more short-term solutions reacting on the pandemic rather than focusing on the sustainability of these services also after the pandemic. For MENA, we see similarly that activities related to IPC and hygiene promotion were very common, while there were fewer activities focused on the enabling environment and especially on ensuring wash services. So for the enabling environment, we saw high activity in multi-sectoral coordination and norms and standards, so the development of IPC protocols, for example, but less activity when it comes to accountability and monitoring of the appropriateness and effectiveness of these interventions. For IPC and hygiene promotion, we saw high activity in implementing these IPC protocols and supporting them with materials and supplies and messaging, but less activity at monitoring whether the implementation of these protocols, and also to ensure the needs of different students in having these services brought to them, for example, those living with disabilities, girls, and so on. And for wash services, we saw more emphasis on water services and less emphasis on sanitation and hand washing infrastructure. And only 3 countries in MENA were found to be supporting wash service providers to expand wash services in schools. And only 1 country went beyond water services to also include sanitation services. So what did we learn from this mapping? Well, we learned that monitoring and accountability mechanisms were generally lacking and are in need of strengthening in order to implement evidence-based interventions targeting those who need it the most. This relates to monitoring compliance, but also tracking indicators relating to WASH. We also saw the need to better support the adaptation of service delivery models for WASH in schools and to improve supply chains for essential WASH services and WASH products, and to diversify to ensure greater availability and continuity of the supply. We also saw the need or the importance of establishing or reactivating environmental clubs or health clubs in schools, or even WASH clubs, and to conduct participatory hygiene needs assessment by gender and age to identify different needs. Particularly for WASH services, there's a need to create a catalog of available or appropriate options for the provision of WASH services, and to give support to service providers, both formal and informal, to expand coverage. So what can we do to support and improve WASH in schools and thus uphold the human right to WASH? We see here an example from the UN and the World Bank, the framework for reopening schools, a report that they have developed, which serves to inform the decision-making process on when and how to reopen schools. And it supports national preparations, it guides the implementation process, and it contributes to overall public health and education planning processes. And this framework has a set of activities at 3 different levels. So prior to reopening, during reopening, and after reopening, with a set of school level activities, including WASH in schools. But at a higher level, we have specific challenges and opportunities. And these include the need to advocate to maintain the focus and political will on safe education and thus to reopen schools safely and to keep them open as well as we deal with the COVID-19 pandemic, but also potential future pandemics, with a focus on IPC and WASH in schools, including improved coordination between sectors and government levels. There's also a need to strengthen monitoring and improve quality of data to inform planning and for advocacy for resource mobilization, and to carry out maintenance and repairs as schools reopen, and also to integrate WASH more in the education curriculum. So ultimately, all of this is not primarily a question of political prioritization, but it's fundamentally a question of human rights, equality, and morality, specifically a moral obligation to uphold the human rights. And the world must recognize the need to consider a Rawlsian social welfare function, whereby the status of those most vulnerable is taken into account while recovering and rebuilding for the future. That's it for me. I'm handing over to Georgette to introduce the next speaker, Laura. Thank you.
Thank you very much, Henning. That was a lot of really interesting information, and I think very good to highlight as well the sustainability or not and how widespread some of these interventions were, especially as one of the leadership dialogues at Stockholm Plus 50 will be focusing on achieving a sustainable and crucially inclusive recovery from COVID-19. So that gave a lot of food for thought going into something like that. And I think it also, you touched quite well upon the linkages we've spoken about earlier about between, for example, the right to to water and the sustainable development goal of people having access to water is also closely related to not only health, but education. And then in its turn, access to jobs and a decent economy. So thank you very much for that introduction. And our next speaker is Dr. Laura Vargas. She's based at SIWI's Bogota office, and she has 15 years of experience in the water sector, contributing to the design, implementation, and evaluation of basic sanitation projects. So Laura, I'll hand over to you.
Thank you, Georgette. Good afternoon to all. Well, the purpose of this presentation today is to recognize the importance of the provision of toilets in public spaces from a human rights approach through 2 cases in cities of Latin America. Please, next. Together with the Inter-American Development Bank, we are developing a project called Sanitation in Public Spaces. The objective is to evaluate sanitation services in public spaces, specifically the provision of toilets in urban areas and establishment of concrete actions for adequate implementation, management, operation, and maintenance of toilets in public spaces in Latin America. The study has a special emphasis on the principles of the human right to sanitation beyond the household and the protection of the most vulnerable. The evaluation is being conducted in 2 cities in Latin America, San Jose in Costa Rica and Barranquilla in Colombia, and also considers existing best practices in other countries. Next. The incorporation of toilets in public spaces is increasingly becoming part of the urban projects of our cities, also because it contributes to provide universal access to safe, inclusive, and accessible cities and public spaces, in particular for women and children, older citizens, and people with disabilities. So to develop this project, the first step was to define the meaning of public space to analyze where the needs were. There is no single definition, so we have had to adapt the definition depend on the context, but a useful working definition and description of public space is the one adopted by Charter of Public Space. Public space is any urban area that is open and accessible to all people, and when one can identify the social and cultural meaning that turns into a public place. In fact, each city may have defined the spaces it considers public, and that could differ from whether or not the public spaces are publicly owned. Next, please. I'm going to show the results of the two first stages of the project related to the current situation of the toilet provision in these cities. That was based on, first, the data collected about the needs of the users through focus groups, mainly with the vulnerable groups, and second, the mapping of almost 200 toilets in the public spaces in San Jose, and if their characteristics meet the principles established in the human rights to water and sanitation: availability, accessibility, affordability, quality and safe, and acceptability, privacy, and dignity. Next, please. Regarding the institutional framework, public spaces often fall outside the remit of formal water and sanitation providers, and those actors are rarely encouraged to include public spaces in their operational mandates, thereby limiting the availability of service. Also, public authorities and local authorities are sometimes pressured to provide water and sanitation services in public spaces, but lack the means or power to force providers who operate such spaces to do so. And that is what we observed in both cities. In the case of Barranquilla, where the land use management plan established the public spaces that must include restrooms in the infrastructure. In addition, there is a public space policy, but both the plan and the policy lack guidelines on the provision of services. In the case of San Jose, most of the toilets identified are located in markets and supermarkets, restaurants, institutional buildings, and shopping malls. Therefore, the majority of public toilets are privately managed, followed by public control. Neither of the two cities has a clear definition of roles and functions in the provision of toilet services in public spaces, and they do not have a register of available toilets. The most affected users are vulnerable groups such as homeless people, elder people, waste pickers, street workers, people with disabilities, public transport drivers, and the transgender population. Next, please. Regarding availability, the existence of independent toilets, also called toilets on the street, is very limited. This mainly harms the vulnerable groups mentioned above, putting their health at risk by spending long hours without going to the toilet. Provision of showers and drinking troughs is almost non-existent, mainly affecting homeless people, whose only option tends to be the social assistance centers. Next, please. Regarding accessibility, 40% solutions for babies or children, the prevailing opening hours are during business hours, public spaces specified 24-hour opening hours were only in gas stations, in fact, mentioned by homeless people as the only place where they could have access to toilets at night. 65% of the restrooms visited indicate that admissions depends on the person in charge of access. Next, please. Regarding accessibility for people with disabilities, most bathrooms had an accessible toilet, and most of those complied with the requirements. Some accessible restrooms were kept locked, and almost all bathrooms lacked audible or tactile signage. Please, next. Regarding affordability, most toilets visited in commercial spaces do not charge a fee for use. 11% charge a fee between 30 and 50 cents of dollar. Spaces that charge a fee include museums, bus terminals, markets, and some food establishments. Although few some charge a lower fee for use of urinals, and payment is in cash, and there is no solidarity payment mechanism. Next, please. Regarding quality and security, these results related to cleanliness, provision of hygiene products and lighting and security were considered adequate in most cases because most of the mapped toilets corresponded to commercial and or fee-paying spaces. However, provision of menstrual hygiene products is almost non-existent. Next, please. About acceptability, privacy, and dignity, most of the bathrooms evaluated are separate by sex. Unisex restrooms are offered for the following reasons. Unisex restrooms established was because only one restroom was available, and some restrooms for people with disabilities were assigned as unisex. 63% of cubicles had solid walls from floor to ceiling. Next, please. Well, based on these results, the next stage of the project will include a workshop on solutions and action plan to improve the provision of restrooms services in public spaces. And I would like to point out some recommendations that we have already identified for the adequate provision of these services. So toilets in public spaces are an important element in the urban agenda, and are an indicator of the quality of life in the city. Governments must establish policies, legislation, and regulatory mechanisms for the design, provision, management, and use of toilets in public spaces. Access to information to the availability of restrooms for public access is fundamental to the enjoyment of public space. The development of innovative and effective service models for access to sanitation in public spaces should be promoted, and the needs of users should be considered in design processes, especially those of vulnerable populations. And finally, toilets in public spaces should be planned under the framework of the human rights to water and sanitation. They constitute an integrating element and reduce social vulnerability. Thank you. Over to you, Georgette.
Thank you so much, Laura. And I think that was a really interesting also deep dive into what we mean when we're talking about provision of toilets. There was many different aspects there to consider. So that was very, very thoughtful and good to hear. And I have a question to yourself and to Henning, if either of you would like to answer that. But I'm wondering, we've heard about the benefit of or what the provision of toilets can mean in public spaces, and that they are needed both in public spaces and in places like schools, whether it's a duty bearer then like a service provider. And I'm wondering, what do you see as the obstacle, or the greatest obstacle, or one of the sort of challenges that's maybe means that we're not where we want to be when it comes to providing these services?
Happy for you to start, Laura, if you want to. Otherwise, I can give a short answer to this. It's difficult to just pinpoint one thing, which is the reason why we're not where we want to be when it comes to provision of these services outside the home or even inside the home. I think that's the question that everyone is sort of grappling with in this space. But I think the COVID-19 pandemic really was an interesting and horrible, but interesting case study in how wash services were provided and how wash services are looked at. Because of course, hand washing became one of the main defenses that we had against the pandemic. And it got a lot of attention, and a lot of support and provisions were being put towards wash services. And this is really great, of course. And us working in wash, we saw this as an opportunity for wash services to get more attention, get more finance, become more sustainable, and to expand these services for the future. So as a sort of black swan event or a shock that would enable wash services to expand further. And I don't know whether we will see this, because we have seen a lot of reactive provisions and reactive activities, which are great, but they are in some ways perhaps temporary. They're not focused on sustainable services. They're focused on short-term services. And this is what we see in terms of IPC getting a lot of attention and disinfection and so on, but not so much attention being given to long-term provision of wash services. And one example is that one of the main activities that we have seen when we have been mapping these responses to the pandemic is the expansion of wash services and the suspension of fees for water, for example. But the expansion of wash services has often been through water trucking. So trucking going out to areas where there haven't been wash services before. And this is temporary. This is not a sustainable solution. And also by suspending fees for 3 months or 5 months for the people who might not be able to afford it during the pandemic, and ensuring that everyone gets a lot of water, that could have a negative effect in the long run, because it means that water utilities who are now not getting the fees, they've been suspended, they will have a hard time to recover the costs that they are now experiencing as a result of the pandemic. And that could potentially lead to, in the long term, fewer investments in water and sanitation infrastructure. So there is a real need to now invest in water utilities, invest in service delivery models, sustainable service delivery models that give appropriate accountability to the duty bearers, to the service authority, to the service provider, in order to ensure that the services are being provided and experienced for the users and the rights holders. So yeah, over to my colleagues if they want to add anything. Thank you.
Okay, thanks, Henning. So just to complement your response, also COVID-19 demonstrated the need for the provision of toilets in public spaces and showed the existing deficit, especially for vulnerable population, such as homeless people. So government had to create temporarily solution for this population. And for that reason, it is important to provide public toilets in public spaces and to provide them for that vulnerable population. Specifically, government has to have programs and public policies to guide those solutions. So is that.
Thank you both. Yeah, and I think you both highlighted there the I guess the pitfalls with temporary solutions there, and as opposed to the sustainable services that that you both also mentioned in your presentations. And I think we haven't gotten any more questions, so I will leave it there. But I want to just thank you all three of you, and Jenny as well, who's not part of the call anymore. But I wanted to thank you all for joining us today and sharing your expertise. I think you all highlighted some very key, we gave everybody some food for thought when it comes to what we mean when we're talking about these human rights, how they're related to other human rights, and as well as how those play into different parts of the sustainability agenda. And I think that Jenny also at the beginning mentioned in her presentation the principle that was declared 50 years ago now, about a person having a fundamental right to an environment of equality that permits a life of dignity and well-being. And I think the projects and the programs that you both presented here speak very clearly to that. And of course, the adequate provision of sanitation of toilets in public spaces, which will improve, hopefully, the handling of wastewater, it will reduce open defecation, and in turn then help improve the quality of the environment around us as well. So I think it's really good to hear these case studies and be able to think about how that's actually impacting not only the health of people, but the health of the environment as well. So thank you so much. Thank you everybody who has joined us and stayed with us for the whole webinar. I hope you enjoyed it as much as I did. And if you want to find any more out about any of these projects, if you head to our website, siwi.org, you'll be able to read more. As I said, we'll send out the recording of this webinar as well to all of you that were in attendance, if you want to go back and listen to anything. So in the meantime, I'll just wish you a good day or the rest of your day, or a good evening, depending on where you're joining us from. And thank you as well to my colleagues. Take care.